And, you know, so I'd like to introduce Katherine. So Dr. Katherine Afzal grew up in the Midwest and completed her undergraduate education at the University of Illinois, Urbana, Champaign with honors. She obtained her doctorate of chiropractic degree from Life University, where she graduated cum laude and received the Contemporary Scientific Paradigm Award for her graduating class. She has over 1,000 hours of postdoctorate training in functional neurology and is a diplomat of the American Chiropractic Neurology Board and fellow of the American Board of Brain Injury Rehabilitation. She is currently in full-time clinical practice at Azzolino Chiropractic Neurology and Integrative Wellness, and serves as the elected president of the California Chiropractic Association San Francisco chapter. Dr. Afzal, put this thing down. Dr. Afzal specializes in the rehabilitation of various neurological and musculoskeletal disorders. She has extensive experience working with children and adults with post-concussion syndrome, degenerative disc disease, developmental delays, dyslexia, learning differences, movement disorders, sciatica, tic disorders, vertigo, sports injuries, and many more. Please welcome Katherine.
All right. Thank you so much, everyone, for having me. Again, as he mentioned, I am a chiropractic neurologist, and I have a fellowship from the American Board of Brain Injury Rehabilitation. So a nice adjunct to what we just learned from a nutritional perspective from Dr. Blake here is also how we can stimulate the brain to keep our brain healthy. So essentially tonight we hoodwinked you into this presentation. I am speaking to you about the main causes of dizziness and some of the innovative treatments that are that exist for dizziness, but my real passion in meeting with people in the community and speaking on this topic is actually something different. It's to improve fall risk for individuals. But if you talk about fall risk, it kind of sounds a little boring. People don't necessarily show up to a lecture to hear about fall risk. That's something you think about after you have a fall, generally. So I'm going to work that into the conversation because it is so important. It is the #1 preventable cause of death among all age groups except for teenagers, and that's because that's car accidents. So it is very relevant. You know, maybe Alzheimer's eventually will be a preventable disease as well. But for now, falls are the immediate preventable cause of death. So let's get right into it. How many people does dizziness affect? Well, 40% of the United States population will experience dizziness at some time in their life. If you're over 72 years old, a quarter of 72 or above aged folks are going to have dizziness that lasts for a month. I mean, that's debilitating and affects your quality of life. The annual cost just of dizziness arriving to the emergency department in the United States is $4 billion. That's not taking into consideration the financial hardship of making sure that you have full-time, around-the-clock care for someone who has unsteadiness. So when we talk about dizziness, we have to really define it, and a good clinician is going to ask appropriate questions to really isolate the type of vertigo or the type of dizziness you're having, and people use different words to describe what they're experiencing. I do complimentary consultations all the time for people who have dizziness because guess what? They don't want to get in the car, ride in this trap of, this contraption that's going to trigger their dizziness further. They just want to stay in bed. They don't want to move, and they want to be sure that I can help them. So I'll talk on the phone, and I pretty well can determine what's causing their dizziness and probably diagnose it just by a good history. So if you have this, you want to talk to someone who sees it frequently so they can diagnose the correct type of dizziness you have. So if you have people who experience vertigo, that's complete movement of the environment or movement of yourself as spinning. Unsteadiness or disequilibrium is different. Lightheadedness, feeling faint or disoriented, all different types of dizziness. So the word dizziness is like saying you have a headache. Okay, well that's great to know you have a headache, but what could be causing it? There's so many varieties of things that could be relating to that symptom. First, we start with a very comprehensive cardiovascular exam. We work alongside many cardiologists. My office is in San Francisco, so we see many doctors in the area where we co-manage things like arrhythmia, okay, making sure that when we listen to the heart, we're also checking the carotids bilaterally, listening for bruits, making sure that on an exam, we measure heart rate and blood pressure when the patient's lying on their back, seated and standing, something that all of you could do with a simple blood pressure cuff at home to determine if you have any fluctuations, because another cause of dizziness that's very common is that people experience orthostatic hypotension. If you stand up and your blood pressure plummets, you're going to feel really lightheaded. You're not going to get blood up to the brain and you're going to feel a little woozy. If you have tachycardic POTS or positional orthostatic tachycardic syndrome, you're going to stand up and you're going to have your heart rate beat very fast, tachycardic. And for these conditions, we again work alongside cardiologists, and we'll work from the brain's perspective of how the brain controls heart rate and blood pressure. So what we start with is we work on a tilt table like this gentleman in the picture, and we'll start with the patient on their back. We'll raise them 5 degrees. We'll keep checking their heart rate and blood pressure every 5 degrees until we start seeing that fluctuation. And once we find it, it could be at 45 degrees, it could be at 60 degrees, it could be 20 degrees. We're going to do brain rehabilitation specific to pathways that fire into the lower brainstem, because that's what controls the heart rate and blood pressure. So at this moment, we're actually training their brain to know where they are in space, and that's going to effectively train what are called baroreceptors or pressure receptors in the carotid so that they can get better feedback so that when you go from lying down to standing, you're not going to feel that fluctuation in heart rate and blood pressure. And it can be very effective. We see POTS occur in many people who also talking about functional medicine this evening, people who have had mold exposure, people who have Lyme disease. We see POTS very frequently. So it's something that affects all age groups in adults. Okay, other obvious causes of cardiovascular risk we just want to make sure we touch on. Transient ischemic attack. Hopefully you're following all of Dr. Blake's great suggestions and making sure that you're arming yourself with decreasing your Alzheimer's as well as cardiovascular risk. Brainstem strokes, you start to see slurred speech, loss of facial tone, maybe constriction in a pupil at the same time that you feel this dizziness. Those are emergency situations. We also see carotid artery dissections. That's the carotid artery up here. You can have a little tear and a little outpouching. You could also have that with the vertebral basilar artery in the neck. These are things that are rare, but they happen, and that's why it's so important that you see clinicians who can diagnose it very quickly. Just last year, again, I said they're rare, but we still see them because we see as high frequency, high number of people in our office. We sent 2 people to the emergency room because we figured it out right away. So these are things that happen. They happen at the same occurrence of people who have a symptom with vertigo. They also tend to have neck pain. And if you have neck pain, guess where you're going to go? You're going to either go to your primary doctor's office or you're going to go to your chiropractor. So the incidence of this happening occurs among all doctors, okay? Let's go to the next one. We can't talk about cardiovascular issues without mentioning the medications for blood pressure, antidiuretics, antihypertensives. These are medications that's also causing dizziness. So we have to look at the whole person systemically to really understand where it's coming from so that we can best provide them care appropriately by exactly knowing where their dizziness is coming from. Okay, another reason you can have dizziness is because you don't feel the world around you. That's called proprioception. That's feedback that our feet get, and it sends signals to our brain about where we are in space. If we have diabetic neuropathies, B12 deficiencies, you could also have a toxicity of B6, vascular issues, then you're not going to feel, it affects small diameter neurons in the feet, and you're not going to feel as much stimulation. I see it all the time as we have patients in their golden years. They're wearing soles this thick. It's great for comfort with your shoes, but it's terrible to give feedback up to your brain about where you are in space. I'm always telling patients, take your shoes off and walk around your house barefoot. I mean, little things like that can make a difference about you afferentating your brain or providing feedback to the brain. Another one that we see very regularly are people who have disc herniations and actually have an impingement in their low back, or even sometimes cervical stenosis in the neck, and that can decrease stimulation through nerves that affect all the way down into the feet. And it does happen where people come in and they think they have sciatica from the low back, and it's actually from their neck, and they have an MRI, and it's not telling you anything because it's looking in the wrong spot. So it's important that your clinicians that you go to do a very thorough examination to figure out where the cause of the problem is. So when you have these type of peripheral neuropathies, you can change them, okay? Nerves, if they have Wallerian degeneration, a type of degeneration that affects the axons, the nerves regenerate at a rate of 3 to 4 centimeters a month. So it's doable. However, you have to remember, if you've got a nerve impinged here and you feel it all the way down in your feet as an effect, think about 3 to 4 centimeters a month. That's going to take a long time. So we speed that up. I generally find that we can speed that up by using cold laser therapy, also actually using electric muscle stimulation around the nerve sites, and spinal decompression to actually decrease if there's any type of nerve impingement at the level of the discs. Very, very helpful for people. So there are other causes of vertigo. Central vertigo, meaning it's due to pathways that also help us modulate information from our inner ear, which we're going to get into in a moment. Multiple sclerosis, spinocerebellar ataxia, that's SCA, that affects disease of the cerebellum, we're going to talk about. Friedreich's ataxia, that's for about age group of 10. Normal pressure hydrocephalus we see with dementia. We also see urinary incontinence. Shunt procedures haven't been, they're not as effective, for every individual who's had those type of surgeries. Arnold-Chiari malformation is when the cerebellar tonsils actually hang down into the spinal cord, spinal canal. And those diseases affect the cerebellum. Now, I hope all of you have seen this on TV and never experienced it yourself. But if you've ever seen someone pulled over and it's a roadside stop and they're checking you for if you've been drinking that evening, they're going to do all these tests, right? You've all seen them. Coordination tasks, what they're doing is they're checking how well are you coordinated with your cerebellum. They're also going to do balance tests. They're going to have you stand and walk in a tandem gait. They're doing that because alcohol affects our cerebellum. The cerebellum's job, and I promise this is the only brainiac neuro slide tonight, okay? I'm not going to throw tons of neurology at you, but we have input from our inner ear. Okay, that's our vestibular system, which is when we move our head, we get feedback through the inner ear. Then those signals are going to go to the middle of the brainstem, okay? Those also send signals out to the eyes, so there's a beautiful window in how our eyes and our inner ear are coordinated, and if those are not getting proper signals between one another, then you're going to have dizziness, which we'll talk about. And the cerebellum is like the master of the orchestra, just playing the symphony to make sure every section is playing their part at the appropriate time. It's the giant nerd in the brain that's calculating how long, how far for me to pick up this water, not spill it as I pull it up to my mouth to take a sip. So the cerebellum is integral in making sure that information from our world around us provides us appropriate feedback. And if you don't have a good working cerebellum, you'll see it with some of those diseases I mentioned. Okay, so again, we're going to talk about how we can look at improving dizziness from an innovative perspective. I mentioned already that we look at how the eyes are regulated with the inner ear. So we do tests that actually look at how the eyes are performing. With vertigo, has anyone ever had seasickness? You guys have a boat. Anyone else have ever been seasick? What do people tell you if you're sick on a boat? What do people say?
Look at the horizon.
Look at the horizon. And they do that because if you stare at a fixed point, you're going to stimulate your frontal lobe, which will dampen vestibular input. So that's why they say that. So when I do tests, I actually want to see what happens when you're not fixating or looking around the world. I want to see all those vestibular reflexes that maybe you're suppressing, because that will help me identify the diagnosis correctly. So we put you in the dark so that I can see all these beautiful reflexes to see if you have what's called nystagmus, or just little square wave motions of your eyes. We also see how well are you able to keep your eyes stuck on a target. And if you cannot keep your eyes around a point, you're going to have less efficiency in some of the pathways that have to do with the vestibular system. Remember, we talked about that giant nerd in the brain, the calculator. That's the cerebellum, so we want to see how smooth you can keep up with a moving target. Are you coordinated, or is it very choppy and jagged? How quick can you move from target to another target? We look at velocity, accuracy, latency times. All things that actually, some of these signs, increased latency times, are some of the things that we see with Alzheimer's, dementia. So it's important that we're measuring from a functional perspective. In neuroscience, we know what normal is. So we can do a test that actually tells us, do you rank up or are you a little subpar? Do we need to do some work in these pathways? Then, of course, the vestibular reflexes. We also look at posturography, okay? This lady is standing on a balance pad, and it's actually measuring how much sway pattern she has, okay? So this allows us to really identify, is your balance issue coming from your vision, or is it coming from proprioception, remember, your ability to feel the ground, or is it coming from the vestibular system? So all of this is graphed out for us. We can look at those different patterns by, we'll have you stand on a stable surface and take away your vision. You're just going to close your eyes, and we're going to see all of a sudden, are you moving in circles? Does your sway pattern get better? Then we'll put you on that foam pad that she's standing on. We'll take away your ability to feel the ground. Let's test it again. Let's see how you're doing. How about when we have you close your eyes and you're on a foam pad, then you're only relying on the brain. That's when a lot of people fall over, because most people, they know to make sure that their vision's working well. They go to their optometrist, ophthalmologist. They know that they need to be able to feel the ground. They're checking with the doctor if they have diabetes to make sure that they can feel vibration sense, joint position sense. But a lot of people miss the biggest part, and that's the brain. So the more you sway, the more fall risk you have. Remember I said I was going to sneak that into the conversation? So if you have increased, the more stable you are, the less fall risk you have. Or to say it differently, the more that you can move on this perturbed pad, the more outside of your center of pressure that you can move, the smaller your risk is going to be. So it can make a huge difference for people to make sure that we have these calculations and do brain exercises to reduce that risk. Okay, we're going to get into some reasons now of why people have vertigo from mechanisms that actually affect the inner ear itself, okay? So this is the most common, especially in your 50s, 60s, okay, is benign positional paroxysmal vertigo. It's when you have crystals that get dislodged from where they live in the inner ear and they get into the semicircular canal, so that when you roll over in bed, your world is spinning. And when that takes, has anyone here experienced that? I'm seeing a lot of head nods. Oh, it is bad. You know, it's scary the first time that happens, okay? So when it takes place, that crystal is artificially stimulating that semicircular canal, and all of a sudden we have an imbalance. This side's normal, this side's saying, whoa, 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 I'm moving because something's stimulating it artificially. And then that's when you create the sensation of the world moving, even though you're still, and you know you're still, and you know the world's still, but your reality is completely altered. So we use technology to be able to determine the type of recanal positioning maneuver that we need to perform. What's helpful with the technology is we don't have to guess. I can actually see the eyes, and we're able to know which canal to do the maneuver for. So can you imagine if this is what was happening, you wouldn't feel so good. Remember, the eyes are linked with our inner ear, and this is exact proof of that. So doing a positioning maneuver can be extremely beneficial. Meniere's disease, okay, this is when we have an issue with the volume and pressure of the endolymph fluid in our inner ears, okay? There's many different mechanisms, just reducing salt, ginkgo biloba, I heard a plug for that earlier this evening. There's pulse treatments, there's also surgical reductions for these. You can actually have an infection that affects the inner ear. These are people, if I'm on the phone with them, I know to send them straight to the ER, to their primary doc, because these are people who are vomiting for hours. I mean, they're miserable. These people need to get on an antiviral or an antibiotic depending on what type of infection they have. And sometimes you can have a labyrinthitis that actually has hearing loss. And then there's also a vestibular schwannoma. This is a benign tumor that can grow, and you'll get hearing loss or tinnitus, and that can be resolved with surgery. So why am I, as a chiropractic neurologist, telling you about all these things? Well, the reason is that these can affect you long term after you have the traditional medical results. So let's take a look at this video.
Atlanta. 20 years ago, he had 2 tumors removed from his brain, which affected his body movement and balance, the exact symptoms of a concussion victim. Like Sidney Crosby, he's turned to Professor Ted Carrick, based at this school, for help.
We get referrals from patients who have largely failed in different therapies.
When you're skating, any difference between if you're doing a turn to the left or turn to the right?
That there's a difference.
The brain is made up of cells called neurons, and they have connections. And the more you activate that connection, the more efficient it becomes. When you have cells that are activated in different patterns, so that someone goes to move their hand and their leg contracts, then that becomes their new pattern. So what we do is we have to break that pattern, and the correct type of stimulation can change that system.
So I want you to imagine that the pictures I'm going to show you are you. You're going to say, is this my left side or is this my right side?
60 or 70% of the time he was inaccurate. So when you look at something that should be your right hand, you're thinking it's your left hand.
Okay.
Something that would seem to be very simple is very humbling.
Carrick puts Bouchard through 3 hours of testing. Wearing special goggles, Bouchard is told to follow a laser dot on the wall. The goggles have cameras on the front, allowing Carrick to watch Bouchard's eyes.
Well, you're way short going to the right, let me tell you.
He would see a target, and when he would go to the target, you could see that his eyes wouldn't go smooth. They would go like pop, 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 pop. And if the target is moving, you'd never catch up to it.
Test starting now.
Now it's time to test balance. Crosby did some of these tests in full equipment.
Professional hockey players falling down on this
Not
path.
only that, if just figure out your balance in skating.
Yeah. Yeah.
How off your skating can be.
Your brain always thinks you're going like this, so your hands are constantly doing this to stabilize yourself. That's what's happening. He had an old acoustic neuroma, the brain tumor, on the vestibular nerve that was taken out. That's left him flat. It's left him with those, the varicose veins,
Notice those varicose veins.
and this lateral pulsion where he falls over to the side. Baseball players or hockey players, they do elicit the same sort of things, especially with concussions, where they close their eyes and they'll fall over.
Once Professor Carrick has finished his testing to determine what part of the brain needs assistance, it's possible a patient could go in here, the gyrostem. There are just 3 of these in existence. Here, the Mayo Clinic in Minnesota, and the United States Air Force Academy. What it does is pretty amazing. As you'll see, Daniel Bouchard comes out feeling like a much different man.
Who wants to do it?
That uses the vestibular system of humankind, and it stimulates it in different planes. So what we did is we started with one plane only. We looked and said, okay, I can see some changes in that. It's good to go. Let's put in another plane. Tumbling forward causes him to fire muscles that would resist that and move back. Moving to the left causes him to activate muscles that would make him move to the right. And you can actually change the somatotopic map on somebody in an hour.
Okay, so basically what you're doing is you're saying, okay, here's what works, here's what doesn't. And by putting you in there, we are going to try and stimulate the things that don't. Is that too simplistic to say?
I think it's beautiful.
It's relaxing in there?
Yeah.
What else does it feel like in there?
You know, you watch your spots, and after a while, all you see is the spot. All you see is the spot, and you're being turned, and apparently it goes fast, but you don't feel the speed.
When you look at your legs, all those darker things go away.
You see a
when you
big
do
difference
this.
here?
The facial expression is better. You know that droopiness is, well, we don't want to make you look not like Sylvester Stallone, but a little bit more. I love your legs, though.
After the gyrostem, Bouchard goes back to the balance test, and you can see improvements.
So the point is, there are many reasons of vertigo that you can have, and even if there are medical managements, decompression surgery, making sure that you're getting on appropriate medication, you still want to look and address function. And that is there's a way for us to actually make this invisible brain, right? You can't see function unless you're blessed to have access to a functional MRI machine. You're really not going to see function unless you start testing it. So you have to test it by looking at balance, by looking at the eyes and these reflexes, again, and comparing how your reaction times are to where normal is. So it's very relevant for people who at one time thought, I had my surgery, now what? I used to be an ex-NHL player, and now I'm just stuck with not being able to skate. But there's a reality that we can change the brain at any time. So other reasons people have vertigo, just very quickly, you can have thinning of this temporal bone, and you can have noise-induced vertigo. This requires a very special CT scan that we do. This can happen after traumas with having a head injury, so that's why it's important that we look at these. Scuba divers or having a sudden change of pressure can have, you can get a perilymphatic fistula where there is a poor connection between the oval and the round window. This may require surgery. I've also seen people get a chiropractic manipulation adjustment at the same time. They're able to reduce the fistula, so it's very powerful to be able to look at things from a functional perspective. So vestibular migraines, okay? This is something I used to personally suffer with. I had migraines for, I think, about 15 years, looking at different causes. I went to chiropractic school. I started getting very frustrated because it wasn't solving my problem, where that's why I went to school, was to help people, and it wasn't really helping me at the time. So I got into functional neurology, and I wanted to understand, why does an adjustment help people? What can it do? How does it change the brain? How does it change the body? And there I was introduced to functional neurology. So my story is, I went and consulted a functional neurologist like myself now, and I did treatment for 3 days. 3 days, and I did the gyrostem and also a number of other therapies within those 3 days, and I reduced my migraines in frequency and intensity by 70%. So the other 30%, now I'm fully migraine-free, was when I started dealing with inflammation and some of the things we heard about tonight. So the reality is, I think that many people focus so heavily on one aspect, the nutrition, the anti-inflammation, but they've neglected the actual stimulation of the brain. And that's the big part of the story as well. I'm not saying one's better than another, but depending on your presentation, you might need a little bit of this and a lot of this, or it might be a little bit of this and a lot of this. So again, my personal story, how functional neurology has really helped me personally, and how I help my patients with it in the same way. Okay, so we see a lot of mild traumatic brain injury in our clinic. This is Sidney Crosby. I'm showing his video being clocked over the head because now he's rehabbed, thanks to Dr. Carrick, who you saw before, and functional neurology. But these concussions, you know, they can happen, and you don't even have to hit your head. I have plenty of motor vehicle accident injury cases that come in, and just because of whiplash, because our head is on top of our neck, which rotates, the most fragile part of the brain that's impacted with concussions is the vestibular system. Because we rotate on our neck, anytime you hit the head, you're going to have some amount of rotation. And with the rotation, we shear, especially the very middle part of the brain where our primitive functions are. How do we know this? Okay, when people have a concussion, they feel nausea, they get light sensitive, they get sound sensitive, they get dizzy. These are the things that are in that primitive part of the brain. So we want to take a look, and again, as I said, this classification of helping people is making this invisible condition visible by doing this type of technology. All right, my husband here is donating to the cause by letting me video him, but we use the gyrostem. It can really speed up healing time by being able to directly access the vestibular system. I control the speed, I control the direction, and I've had all the way up to 76-year-olds in this, and they will let me flip them, believe it or not, even though they have dizziness. I've had a Parkinson's, lady with Parkinson's who was Camp McCormick, had total freezes when she's tried to turn with the tremor. She's completely standing upright now, and she's able to ambulate around the world around her without any aid anymore of a cane. So again, you want to look at nutrition, you want to look at these things, but don't forget the brain. Don't forget to stimulate the brain. That is going to be the second half to create neuroplasticity. Just two more here very quickly. Malday debarkment is if you get off a boat and you continue to feel like you're moving. It's very, for many people, okay, at a couple of days it goes away, but I get the patients who come in where they continue to have it for months and months and months. And so we'll do different therapies to help stimulate the brain very specifically for what their needs are and help them with those symptoms. And last here is persistent postural pervasive dizziness. It's just a fancy classification for people who continue to feel like they're moving when they're still. A lot of times it starts with some type of BPPV, or they'll have a Malday debarkment and they think they're okay for a while, and all of a sudden this rears its ugly head again. And so that's what we've started to term this as, triple PD. And the best therapy for this is vestibular imbalance rehabilitative therapy. So these conditions are the type of people who are turned away from the neurologist, you know, saying, all your tests are normal. But then, doc, why do I keep feeling the subtle movement? It's driving me crazy. I don't feel like I'm on the ground. I've had a patient who was hit by in a concussion, and they continue to have this following that, and they felt completely dizzy when they go and walk through a grocery aisle. And just all the different things flashing by them so quickly in the grocery store was causing dizziness for them. So these conditions, they are prevalent, and every single condition has a different type of treatment. And even if there is a mainstream medical model of treatment like surgery, it also should be considered to do specific type of neurologic and vestibular therapy. And how we do that is by getting more diagnostic tests to really understand how the brain's performing, what's not doing its job, and then we'll be able to give them appropriate, specific, customized exercises to get the brain working again. Okay, any questions?
So I have this with the crystals. I don't remember the name.
You have a BPPV?
Okay, quite often. What causes it?
So
and how can I get rid of it alone?
So you can try to do so sometimes I have seen that people just didn't ever get rid of it in the first place. I have people who avoid going to the dentist, or they can't sit back at the dentist, they can't get a massage. For 15 years, they just avoided putting their head back. So sometimes it's just because you didn't really fully get rid of it. Other reasons it's speculated that just as we age, the otoconia become looser just because of degradation to the area. So it could be happening frequently. But the best thing that you can do, what I've found, is by going a step further and actually doing some cerebellar therapy after we actually clear the crystals and do a repositioning maneuver. And people tend to do better. They're just more stable, because you do have those people who get it reoccurring. So I would say do some additional type of therapy. But in terms of what you can do about it, there's plenty of YouTube videos. Just be careful, because I have had people in a world of hurt because they went the wrong direction.
I just want to say I really appreciate the one thing I took away from your presentation is the various causes for, one simple thing like dizziness.
It really is.
Amount of diagnostics you go through to try to figure out what the root cause is, because I went undiagnosed with cardiovascular malformation, for about 10 years. And it was absolutely maddening to have pain and dizziness and balance problems and vision problems and go from doctor to doctor that just said, it's all in your head. I know it's in my head.
It literally was in your head, but people had to find out why.
But the surgeries were quite traumatic, but the diagnosis,
was important,
which allowed the correction, and it was a miraculous turnaround as I went through that.
Well, thank you so much for sharing. And that's my goal, is for you guys to be armed with more information so that if you have a friend or a loved one, you're going to be able to say, hey, you know what, maybe I heard about this. Is it possible this could be the case? Or does your doctor know about all of these kinds of things? Because they should be ruling those out. Any other questions?
I've seen many times on TV, etc., when, let's say, soldiers are standing straight, locked, with locked knees, and suddenly one of them just get dizzy and collapse. What's causing it?
Well, in that case, it could be just the fact that they're doing so much exertion without moving. So you're getting a lot of pooling of, blood vessels down to the, pooling in the feet from the venous backup. But imagine you standing for that long, not being able to move, and then the heavy packs that you have on. So it's probably more of a circulation issue, most likely. Any other questions?
Yes, I have a friend who had a benign brain tumor, a rather large benign brain tumor removed, and ever since then she's been sort of dealing with
disequilibrium.
It's kind of like not that vertigo. It's just like it's a little bit unstable walking.
Yeah.
Now that's something that's a result of the surgery or the anesthesia, or how would you approach that?
That's a good point. You bring up the anesthesia. I think that is part of it. But the reality is we don't know. But I can tell you, sometimes when people come in, they just have this generalized state of unsteadiness. They know that 2 years ago, that wasn't the case. They felt really stable, and they just know that they're in their 70s. They don't want their 80s to look like that. They want to stay as mobile as possible. Sometimes it just takes a little bit of treatment just to really lock in and figure out what it is we can do for someone. Sometimes it's also helpful when we look at these reflexes. I'll determine that people have issues more in the vertical plane when we look at reflexes instead of the horizontal. And that tells me to alert them, get rid of step stools in your house. You're not going to get up on ladders anymore. Sometimes people just need to be told those simple things to avoid fall risk. So I don't know if I answered your question, but was there any other question that you had regarding that? Okay.
I had two whiplash.
Whiplash?
It's about 2 to 3 weeks ago, 2 to 3 years ago. But I always did some acupuncture, some massage, but never really feel right about my neck. But I have onset for my high blood pressure for 10 plus years. But recently I have this episode in the middle of the night, like 12 o'clock, my heart rate raised and the blood pressure was high, so I go to emergency. So two things is after so many times, my blood potassium was low. Yeah. So I came back and take it, and it comes back again. So finally, I asked for strip A test. It's a bacteria thing in the throat. Yep. And I take 10 days medicine. It's the symptom reduced. But I always feel the neck is not right. My blood cannot supply to the brain. I'd like to know if your practice will offer some kind of test to, I don't know.
So there's a couple things. One, you touched on strep. Okay, have you guys heard of PANDAS, pediatric autoimmune neuropsychiatric disorder, autoimmune disorder? This is where you have an infection like strep, if a PANDA is associated with strep, or just PANS if it's associated with Mycoplasma pneumoniae is very common, or Borrelia burgdorferi, or just called ANDAs if it's just in adults. These are infections that love the brain, and they love winding these things up. Remember that last type that I mentioned, the persistent postural pervasive dizziness? A lot of times I find that there's actually infections winding up the brain and causing this dizziness, so we do take that approach. So that could be part of what's taking place. It's really winding your brain up and really changing some function. Potentially, if it was the strep. Potentially. The second part is, just do this with me, humor me. Put your fingertips on the very back of your neck. It's going to be right on your suboccipitals back here. very, very, very light touch. Don't press in too hard. You're going to close your eyes. Move your eyes up, down, left, and right, and see if you feel little muscles moving. Can you guys feel it? Yeah. Okay, some people are getting it. So the point is that our eyes are intimately connected with our suboccipital muscles. Remember, we already told you the inner ear is connected with the eyes. If you have a whiplash injury, not only are you getting trauma to the neck, you said you've been doing acupuncture, you've been doing things to heal the structure. However, if the brain twists on itself, there's some shearing force, you could have affected the inner ear or the processing of information from the inner ear and the brainstem. That's most common with head injuries or with any type of trauma to the head. And then all of a sudden, our eyes are not working well. So if your eyes are just moving a little bit, then you start getting spasms in your neck. So there's this whole circle about how the brain's associated with musculoskeletal conditions.
So this called so I like your comments for my 10 times, 12 times in the past 3 months for the midnight of palpitation suddenly. But when I go to the emergency, relax, and it goes away. Have you seen anything like that?
I haven't. The cause is really vast in what's taking place, so it really would require a very thorough workup. I can't say for certain what's the trigger for you.
Okay.
Just giving a couple points
so
there.
When you say I feel that when I move my eye, I feel that also. So is that a sign of I have injury in my neck? Or?
If you have a whiplash injury, you don't actually have to hit your head to have a concussion. Our brain can twist on itself with high velocity over a short period of time. You know, family reunions. My mom's one of 13 kids. We have tons of cousins. We play egg toss games. How you catch an egg over time without it breaking is you slow down the catch. You protect that egg from shattering in your hands. If you catch it quick, there goes the egg. So if you have a head injury with whiplash, our head moves really quick over time, and that can cause shearing. And that could affect the vestibular system, which could also be linked with how you view the world. And if your eyes are a little bit jerky, as you look around, your muscles in your neck can spasm. Does that make sense?
I think my symptom is I'm concerning about the neural system was damaged by the twist of my muscle or compression or whatever. Because every time I do this exercise, I went to a class, and my blood pressure will go down. But
so there's probably more of a brain connection with it than just structure. And
so what's the treatment option I have?
I would start by doing this type of workup with a video nystagmography test where we actually look at the different reflexes and see if you're performing at the right level.
Then you can nail down what is the injury.
You're either going to be normal or you're not. That's the beauty of it.
What part of the keyword?
What was it?
What is the disease? What is the injury?
It's called a central vestibulopathy. Central vestibulopathy.
Yeah. Have to do with vision too.
You can come up and talk
Okay.
with her a little bit after.
All right.
Thank
Any
you for
other
the
questions?
That actually was very educational on many levels. Let's take one more. I think actually.
Yes.
Thank you for that. It was very interesting. We have a pet who became injured and was prescribed prednisolone. And after 2 weeks, our cat was becoming nauseous from it. So the vet said, stop it. So we stopped it. And the cat developed nystagmus, eye movements, and then dizziness.
What we just saw in that video of the eyes.
And walking in a circle. And I read up on nystagmus, and it said that one of the causes is an immediate and sudden stopping of the prednisolone. So that is something we might need to think about if we're on meds. Even if the doctor says, okay, you're nauseous, you better stop them, we might want to go down slowly.
Absolutely. There's some medications that can cause those effects. Again, that's why you want to work with someone who sees this on a regular basis and doesn't just jump at the first sign without taking a full history. So thank you. Good.
All right, please thank Dr.
Thank you
Katherine
so much.